welcome to today's update on the healthcare system. Bonjour tout le monde et bienvenue à cette mise à jour sur les soins de santé. This morning's speakers in the following order are the Honourable Susan Holt, Premier of New Brunswick, and the Honourable John Dornan, Minister of Health. Les porte-parole aujourd'hui sont dans l'ordre suivant. La Première ministre de Nouveau-Brunswick, l'Honorable Susan Holt, et le ministre de la Santé, l'Honorable John Dornan. Avant de céder la parole à la Première ministre, voulez-vous assurer de désactiver le son de vos micros? Before I turn things over to Premier Holt, I would ask everyone to ensure their microphones are placed on mute. Premier.
Good morning, everyone. I'm pleased to be here today to provide you with an accountability update on the progress that we're making on our healthcare system. Clearly, healthcare has been our government's number one priority because we firmly believe that every New Brunswicker deserves access to care close to home, the right time from the right person. And New Brunswickers have told us that healthcare is their priority as well. So we are making investments and we are making major changes in our healthcare system in order to deliver that to New Brunswickers. Pour nous autres, notre gouvernement, la priorité numéro 1, c'est notre système de santé. Et on a entendu le même des Néo-Brunswickois et Néo-Brunswickoises. On pense que chaque Néo-Brunswickois et Néo-Brunswickoise mérite avoir un accès aux soins dont ils ont besoin, quand ils ont besoin, proche de chez soi. Alors, on a commencé ce travail, c'est pas exactement 18 mois. On est presque à 18 mois de notre terme, mais on a commencé dès le premier jour de faire des changements dans notre système de santé pour améliorer l'accès et améliorer les résultats pour les Néo-Brunswickois. Et aujourd'hui, nous sommes ici comme partie d'un exercice d'imputabilité, de démontrer les résultats, la chose qui va bien, la chose qui ne va pas bien, pour que les Néo-Brunswickois vraiment connaissent et comprennent la réalité de leur système de santé, le travail qu'on fait et le travail qui reste à faire. So for us, this is an exercise in accountability. We know that governments, of many governments, do announcements, announce things that they're going to do, things that they're starting. It's a really common activity. We launch strategies, we put out plans, but it's less common to see governments come back on those announcements and let people know how they're going and what has been done since. Given that it has been a year since we launched our first collaborative care clinic, it's been about 6 months since we launched the provincial health care plan, we thought it was a good time to check in with New Brunswickers and provide them with details on how things have been going. We are very committed to transparency and accountability. We believe New Brunswickers should have access to the information that they need about the things that matter to them. And so we have been regularly sharing information with New Brunswickers about the actions that we're taking and the impacts that those actions are having. Today, we're going to share an update on our progress with collaborative care clinics. We're going to talk about our progress with the retention and recruitment of our critical healthcare professionals. We'll talk about an update on our provincial health plan and how we've been progressing against those actions since they were announced 6 months ago. And then we'll provide a couple, a point of interest, I guess, or one of the things that has stood out since it's been about a year since that announcement. And we are committed to continuing to provide updates like this in the future. Once a year, we think is not enough to give you the information you're looking for about how things are going in our healthcare system. Alors, pour nous autres, on croit que les Néo-Brunswickois méritent avoir accès aux informations claires, réelles sur leur système de santé. Ce qu'on va partager aujourd'hui, c'est une mise à jour sur nos progrès sur les cliniques de soins collaboratifs. Qu'est-ce qui se passe sur la situation de notre main-d'œuvre, nos professionnels de santé, leur rétention, leur recrutement. On va partager notre progrès avec le plan de santé qu'on a lancé 6 mois passés. Puis, on va aussi partager quelques informations de quelque chose qu'on a annoncé presque un an passé, parce que je pense que c'est des nouvelles intéressantes. Et on est résolu de continuer de faire des communications comme ça, à une fréquence plus qu'une fois par année. On pense que ce n'est pas assez d'avoir une mise à jour sur le système de santé de façon annuelle. Alors, let's get at it. I'm going to start with collaborative care clinics. It was a little over a year ago, on April 7th of 2025, when we announced our first collaborative care clinic under the model that our team has really focused on rolling out across the system. As folks may recall, we had committed to creating 30 of these collaborative models of care across the province during our time in government. And in our first year, our first calendar year, I guess, on the job, we had announced 11 of those. And to date, we've done 3 in this calendar year. The goal is to reach 12 in this calendar year. But more specifically, we have announced 14 to date. The 15th will be announced next week. So that puts us at our halfway mark, even though we're only not quite 18 months into our mandate. So we're feeling very optimistic about the likelihood of us achieving the committed goal of 30 collaborative care clinics in our term. But I do want to specify, j'aimerais partager que on a un focus sur des cliniques spécifiques qu'on annonce, mais ce modèle de travail, à cause du fait qu'on a changé le contrat pour les médecins, on a ajouté des supports pour qu'ils adoptent ce modèle. On voit qu'il y a plusieurs groupes qui choisissent de rentrer dans ce modèle, de créer des équipes qu'on imaginait, même si on ne va pas tous les annoncer. Alors, on a un focus sur 30 dans des régions où on a des besoins, dans toutes les régions de la province, mais il y en a d'autres qui ne vont jamais être annoncés à cause du fait que les médecins et les infirmières praticiennes et d'autres, ils s'organisent, ils ont adopté, ils ont vu la vision, puis ils ont agi. So while we are focused on making sure that we meet our commitment and that we put these clinics in place in communities of high need across the province, we are seeing nurse practitioners and family doctors and others come together and create these clinics on their own that we will never announce. And that's happening through Vitalité and through Horizon and outside of those systems as well, while we focus on making sure that we get good examples of fully supported models adopted and rolling in every corner of the province. So I'm going to go into more specifics. The 1-year anniversary of the Fredericton North Clinic has come up first. As I said, that was April 7th. They have, since that announcement date, attached 1,155 patients. Their goal was 1,600 patients, so we have a little ways to go to achieve that. We committed at that time to new space, and that has happened. So they launched in their new space in December of 2025. We committed to adding healthcare professionals to the team, which has also happened. They've built a full care team out with a complement of physicians, nurses, nurse practitioners, in their case, a pharmacist in that team, folks focused on specific nursing care. I think there was a specialist.
Yes, nurse practitioners, pharmacists, they have...
It's a diabetes care nurse?
Diabetes, yes, you're
That's
correct.
right. So they have a specialized diabetes nurse for that practice. They've had a smooth transition to the new location. One of the things that you'll note as a common refrain in these updates is we have seen some turnover in healthcare professionals, but because we've moved to this collaborative model, even though there was the retirement of a physician, a departure of a physician, those patients didn't become unattached. So there were 800 patients that otherwise in the past under an old model would have moved back onto the waiting list, but have been retained and supported through this clinic model. They have a couple more physicians coming on board in June of this year, and so they have a plan to attach another 1,600 patients with the addition of those 2 healthcare professionals, so that will take them above their target goal. And if anyone has had a chance to visit the Fredericton North Clinic, they'll see that it's a really interesting use of space. They've invested in training space, so they have great places for new residents to come and be part of a team and get a really interesting type of support from the family doctors there, with the way that there's observation rooms and coaching spaces. And so we're really excited about how the Fredericton North Clinic has been progressing. Le deuxième que je veux partager en mise à jour, c'est la clinique à la Mecque. La clinique à la Mecque, c'est une situation un petit peu différente. Alors, pour eux autres, à ce point, ils ont, et ceci c'est un autre thème qu'on a réalisé, c'est la situation avec nos données en santé. Nos listes de patients, des fois, sont des listes sur papier. Et maintenant qu'on pousse pour avoir des systèmes informatiques de nos données de santé dans chaque clinique. On réalise qu'on avait des informations de patients qui n'existaient plus, qui ont déménagé, qui n'ont plus besoin de services. Alors, à ce point, ils ont une diminution de 73 patients. Ils ont un objectif ambitieux de 3700 patients. Quand on a annoncé ce clinique, puis c'était le 9 avril de 2025, on a décrit une période de 3 ans pour l'ajout de 3700 patients. Alors, on est durant la période de travail, mais il y avait un nettoyage nécessaire de la liste de Medicare qui nous donne d'informations plus fiables. Ils ont maintenu la prise en charge de patients. Comme les cliniques à Fredericton North, ils ont intégré ceux qui perdaient leur médecin de famille dans la pratique à cause du fait qu'ils ont rentré dans une pratique collaborative. Tout le monde dans ce clinique, à ce point, les médecins et les infirmières praticiennes, ajoutent de nouveaux patients. Ils ont de la capacité, puis ils enlèvent des patients de la liste d'attente aujourd'hui dans la région de la Mecque. Alors, ils ont tous la capacité d'ajouter et ils font ce travail à 7 jours. Alors, on voit que les chiffres vont changer d'une façon plus vite pour le mois qui s'en vient. À cause du fait qu'ils ont réglé les enjeux de l'espace. Ils ont, comme on a décrit, ils ont adopté la technologie Vitre AI. Ça, c'est un programme qui leur donne des aides avec l'administration, avec les besoins de leurs patients. Et ils ont une capacité accrue pour les soins complexes grâce à l'ajout d'une infirmière spécialisée en gestion de cas complexes. Alors, ils ont ajouté cette capacité dans ce clinique-là. Ils prévoient accueillir 2 médecins du programme d'évaluation de la pratique, Practice Ready Assessment Program. Ils prévoient que 2 médecins de ce programme vont venir aux cliniques à la Mecque et vont s'ajouter à ce clinique-là. La troisième, the third that I want to provide an update on is the Tantramar Clinic. That was announced on April 15th of 2025. At the time, we committed to attaching everyone in the town within a year. The team at Horizon was optimistic that they could do that. At this point, we haven't reached that goal. We have 277 people have been attached to the clinic there. The goal was about 1,000. That was about the size of the waiting list that remained. The challenges in this case were related to the facility and the space limitations that they've experienced. And they've also had some similar challenges with needing to clean up finalized patient lists, make sure that we have accurate information about who's getting cared for by whom. And so we are expecting more patient onboarding to happen in the next 3 to 6 months. But importantly, there's work being done on the long-term growth plan for new clinic space. That work is in design. There's about an 18-month timeline on it, and that is work that we're doing collaboratively with the Rural Health Action Group and the medical leadership team in the community of Tantramar. They've been incredibly supportive and engaged community. They recently raised money for the Sackville Memorial Hospital Foundation of about $150,000 for new equipment to improve their capacity to serve. And so our team is working closely with the team at Tantramar to make sure that the space challenges are being addressed, the data challenges are being addressed, and the team there is going to onboard patients over these next 6 months to make sure that that community is getting the coverage and the access that we envision. Alors, ça sont les 3 cliniques qui ont eu des anniversaires durant le mois d'avril. We announced more clinics in May and June and August, May, July, and August. So you can anticipate that we will provide you with an update on the progress of each of those clinics as we come along to their anniversary points. But we're pleased. We're pleased with the adoption of the collaborative model. There have been some bumps to work out in terms of how you build these teams, how we work with the data, how we create data how we clean up data that isn't accurate to make sure that we can be reporting to New Brunswickers real numbers about where attachment is happening and how. But we're pleased to see attachment happening at the Tantramar Clinic, at the Fredericton North Clinic. We believe that Lamec is on the right path, even if it hasn't been as speedy as I always would like. So I want to switch over to talking now about healthcare professionals, notre main-d'œuvre dans le système de santé. When we came into government, we were very clear that the healthcare system needed to be stabilized because we needed to care for the people who were caring for us. That nurses in this province deserved a respect that they hadn't been shown. And one of our very first moves was to provide them a retention bonus to ask them to stay with us as we make changes to the system so that the pressure that they were experiencing by working short was relieved. And so we have been looking very closely at retention data to see if those investments and impacts got the result that we wanted. The data that I have now, it goes back to April of 2025. So we provided, as you may recall, retention bonuses at the end of 2024 and then again in mid-2025. And I'm pleased to say that nurse turnover at Horizon in particular has improved significantly and stabilized at 0.93%. This has come down from an average of 5.54% the previous year and even higher the year before that. So that stability in our healthcare system, having those nurses, and I'll talk in a moment about the recruitment figures, nurses in the system, the exiting has ceased. The retention bonuses, we believe, did what they were to do and have allowed our recruitment team to catch up and add significantly more healthcare professionals. Alors, nous sommes vraiment heureux de voir que la rétention de nos infirmières, nos professionnels critiques dans le système de santé, a amélioré considérablement. On a vu une stabilisation à 0.93% de l'enrôlement des infirmières à Horizon, puis c'est comparativement à une moyenne de 5,54% l'année précédente, de avril 2024 à mars 2025, et c'était plus gros même l'année avant ça. Alors, je parle pour un moment du réseau de santé vitalité. Les deux cas sont un petit peu différents à cause du fait que le réseau de santé vitalité a une population d'infirmières plus petite qu'Horizon. Il utilise des travel nurses. C'est quoi ça en français?
Travail infirmière.
Oui, merci. Mais leur taux de roulement est 4,16% à ce point. C'est quoi le mot? Positivement, les infirmières praticiennes est maintenant un taux de roulement de 0 depuis juillet de l'année dernière. Ça indique vraiment une meilleure rétention des infirmières praticiennes. Alors, on voit un mouvement vraiment positif au sujet de rétention de nos infirmières. Now, in terms of recruitment of healthcare professionals, in our last fiscal year, so ending March 31st of 2026, we had the highest net increase in physicians in the province's history at 67 net new healthcare professionals, net new doctors added to our system. To break that down, that's specifically 15 family physicians and 52 specialist physicians. That does represent a lot of activity. So we recruited 55 new doctors to the system and experienced 40 retirements or departures to give us that net 15 more family physicians. So you can see there's a lot of work that goes in to recruit just to manage the retirement numbers and then to continue to recruit more to grow the population of doctors in our province. On the nursing front, we have a net new 468 nurses added to the province. That represents 827 hires in a year. So that's hiring more than a nurse a day because of the exceptional effort of the recruitment team and others. We experienced 358 exits or retirements from the system to deliver that net increase of 468. And that breaks down to a net increase of 284 registered nurses and 184 licensed practical nurses. Unfortunately, we still don't have the data for nurse practitioners the way that we would like. We'd like to be able to provide that across more professions, but how nurse practitioners are employed and tracked is different in both health systems. And again, I'll say it again, the challenges of getting our hands on the data that we want in order to manage the system the way that we would like to has been something that we've really been working through over this last year and continue to as Vitalité collects data one way and Horizon another way, and they report information different ways. And We're converting a lot of paper records to digital records, making sure that that adoption of records is happening so that we can know by the person who's getting what care where in this province pour aider à nos choix de gestion, à notre investissement de ressources et de notre focus pour vous autres. So in all this good news about the addition of more doctors than we have ever added to our province in a given year and nurses, there are still challenges in particular areas, and I'm going to hone in on family physicians specifically because that's been our focus. We have challenges in 3 zones in recruiting family physicians right now. Zone 5, which is in the Campbellton area, Zone 2, the St. John area, and Zone 3 in Fredericton. And so special effort is being made in those areas to make sure that we are directing our recruitment resources to attracting people to those communities. You'll see with the Practice Ready Assessment Program that's going to graduate a new cohort on Thursday night, how we direct those people and their commitments and contracts to serve us will respond to some of these needs that we've identified. I'll also repeat that we are focused in vacancies across the system. We know that there are significant vacancies in our ambulance system, and so we extended the paramedic tuition bursary program with 49 graduates having received the first bursary already. More in training programs right now. We're seeing that program work with enrollments increasing in the training programs so that we can get after filling those critical vacancies very quickly. Alors, ça, c'est la mise à jour sur le progrès de nos cliniques, les 3 qui ont eu leur premier anniversaire cette année, et notre progrès sur le recrutement, l'augmentation nette de 15 médecins de famille. Au Nouveau-Brunswick, l'augmentation des infirmières autour de notre province. Je vais passer la parole au ministre Dornan pour vous donner une mise à jour sur le progrès sur notre plan de santé.
Thank you very much. You know, this is an opportunity to be transparent, and not all the news today is good, but much of it is. 6 months ago, we introduced the Provincial Health Plan, which is done every 5 years, and it's nice that it happens early in our mandate, and it guides the work we do. The plan includes 33 initiatives designed to improve access and quality of care and sustainability in our system. Progress we've seen is meaningful and it's making a difference in people's lives. I received my mandate letter and it says, follow the plan. And we're seeing that on a very regular basis. Deputy keeps me to task. I have other ideas, but I'm told to follow the plan and it's succeeding. We have implemented a strategic and action plan for people with Alzheimer's disease and dementia to improve the care for New Brunswickers living with dementia, mental health, disease, and better support their care partners. Our long-term care plans, we are also seeing meaningful progress. 624 new long-term care beds are underway, including 240 at expanded Shannock's campuses, sites, where 3 groundbreaking events are have occurred or are going to occur this week. 6 nursing homes are beyond good life, and they're being replaced to provide modern, higher quality, single patient rooms in a top-notch environment. In our budget this year, we've committed $10 million to improve home care affordability. $4 million to expand Nursing Home Without Walls, a New Brunswick-born initiative that is now getting worldwide attention. We're adding $9.3 million to increase wages for personal support workers in adult residential and home support facilities, and $2.6 million to increase the hours of care in our nursing homes. We are strengthening frontline services by expanding the extramural program. This is, again, another gem in New Brunswick's crown, and we continue to strengthen that. We want to deliver more care for seniors and people with disabilities at home while reducing pressures in our hospitals. We have launched the Addictions and Mental Health Court Program, with its first cases now underway. 9 individuals have already been referred to assessment. 2 have already begun participating in treatment plans. We are helping doctors focus more on patients and less on paperwork through the implementation of our digital health strategy. In fact, people that sign on to our collaborative care clinics, one of the necessities to receive the capitation fees is to be in a digital medical record system. We're making steady progress on key initiatives, expanding cancer screening programs to improve early detection, early treatment, further expanding the nursing home without walls, and as well advancing stepped care 2.0 to improve access to mental health services. Overall, 26% of our initiatives have been completed, and the remaining are in active progress. We are expanding access to pulmonary rehabilitation services for New Brunswickers living with chronic obstructive pulmonary disease in both our community colleges and other health conditions. I was at an opening, or not an opening, but a viewing of a service for pulmonary rehab that is student-infused in the St. John area. You can guess that it means that people that are training to become respiratory therapists are already helping people in a clinic that has been designed by them for our seniors that have COPD. We're helping individuals better manage their health, improve their quality of life, and reduce the need for hospital visits, and this has been shown. New Brunswickers deserve a healthcare system they can rely on. They deserve transparency and how that system is performing, and confidence that we're moving in the right direction. We know that there's no simple single fix. You know, early in my mandate, I thought, well, collaborative care clinics are going to fix everything. It's not quite that simple. They go a long way, but there's lots of care opportunities adjacent to that. Same time, we know that for many New Brunswicks, the system is still not meeting expectations. I get called publicly, I get emails, I get texts, and it tells me that we have a ways to go. We're moving positivity forward, but there are still some real challenges, and that's why we have to keep going. That's why we're here today to report, and some of our thoughts are moving ahead. Our work is far from finished. As I've said, real transformation takes time, but we remain focused on delivery and improvements New Brunswickers expect and deserve. And I'm going to make a plug for the collaborative care clinics. We have the best collaborative care clinics in the country. How do I know this? I've talked to many provinces and their versions of collaborative care clinics, and some of them are directed towards salaried physicians exclusively. But none of them are as flexible as ours is, and we started working on that within the first year, before January, the first year of Premier Holt's government. And so we have modified it, we've made it flexible, it's taking on traction, and I just repeat Premier Holt's idea is that it's not just the 30 plus that we announce, it's all the others that are collaborating. And I have to tell a story. One of my friends the other day said, this collaborative care clinic, it sounds like what my doctor's doing. And I said, well, who's your doctor? And they gave me a name that is not part of the list. These physicians are already bringing in colleagues. They used to work together in the same office, but never looked after each other's patients. And now they are. And they're having an electronic medical record that they can share files, and bringing in a social worker for these groups of physicians, and are hiring 2 more doctors this coming summer with the recent graduations. So we're seeing it, not in the clinics not just in the clinics that we announce, but in other organization of physicians, nurse practitioners, pharmacists, dietitians. And so we're quite pleased how it's catching on. There's momentum in collaborative care. Thank you. Premier.
Yes, thank you, John. I want to touch on one particular announcement that we made about a year ago that was particularly special for me and some members of our team. And since it's now been about a year since we put that in place, I wanted to provide an update to New Brunswickers. We committed to easing the financial burden on families that were struggling with infertility through our fertility treatment reimbursement program that we enhanced significantly, so that the program today now provides full reimbursement for the cost of an IVF round of treatments up to $20,000, as well as coverage of intrauterine insemination programs. In the past, the previous program had supported 154 families. Since we put this new program in place, I'm proud to say that we have supported 378 families on their journey through infertility. As some of you may know, this can be an emotional journey, and removing the burden and the question of the cost on the family can take a real weight off people's shoulders. And I can't tell you how much I love receiving messages from the families that have been able to complete their family through leveraging this program that we put in place. It's one of the more special things that I get to experience in this job. I want to thank everybody who sent me a note to share with me that news. It impacts some members of our caucus who are now grandparents thanks to this program. Even affects we have a premier's office baby now thanks to this program. So it's something that we've done that I think is making a real difference. And I'll even then tie it to a bigger challenge that we're experiencing in our labor force. New Brunswick has a shortage of healthcare professionals and a shortage of other critical professionals and trades and areas that we desperately need if we're going to be tackling New Brunswickers' number one priority of getting them the healthcare that they need. And we won't be able to solve this problem just through immigration alone. We need to be growing our population here in New Brunswick, and we need to be attracting people from all over the place. And when New Brunswickers want to grow their family, I'm really pleased that our enhancements to the fertility treatment program have resulted in 378 families this year being able to take advantage of that program. So just a little personal note I wanted to add. Je vais répéter un petit peu en français que je suis vraiment fière de le programme qu'on a mis en place, le programme de remboursement de traitement de fertilité. C'est un programme qui comprend tous les coûts pour avoir un enfant utilisant FIV ou IIU, des processus comme ça. Et j'ai entendu d'une famille qui me disait ils utilisaient le service à Moncton, mais ils ont vu des familles qui venaient du Nord. Ils venaient pour des traitements 2 ou 3 fois par semaine, chaque fois en avoir un chambre à hôtel, prendre la route, faire le plein de leur voiture en essence, tous les coûts, toute la pression que ça met sur une famille durant un temps vraiment difficile et vraiment émotionnel. Le fait d'enlever la pression financière pour ce que des familles peuvent choisir cette approche, et le fait qu'on a plus que doublé le montant de familles qui ont pu utiliser ce programme cette année. C'est quelque chose que ça me fait chaud au cœur. Alors, juste ce petit message personnel qu'on fait du travail, on fait des programmes et des politiques, des investissements, et on voit les résultats. So in summary, progress is being made, but we still face real challenges. You'll have heard me describe challenges on data, challenges with space, challenges to move as quickly as we would like, as we still see turnover of healthcare professionals, but we are making forward progress. We're losing 40 family doctors, but we're hiring 55, and we're seeing a net gain of 15 family physicians in the province year over year. In those 67 more doctors that we've added, more than New Brunswick has added in any year prior. We are moving on clinics, and we are learning with every clinic that we open different ways to build the team, different ways to utilize space. Next week, we will announce our 15th collaborative care clinic, which is halfway through our program and only 18 months on the job. And we will continue to be transparent about all of this, about where we're facing challenges like Campbellton, St. John, and Fredericton, about where we have clinics that aren't rolling at the speed that we would like them to 1 year in, and where we're making progress with like the initiatives that the minister articulated on our provincial health plan. 6 months in, where 26% of initiatives have been complete and the rest are underway. We're seeing positive signs. And our team is laser focused on doing everything we can to improve your access to healthcare and to share that information with you every step of the way. Notre équipe, on voit des progrès réalisés avec des cliniques qui ouvrent, avec l'augmentation de nos professionnels de soins, les médecins de famille, les infirmières. On voit des patients qui sont maintenant attachés aux cliniques, mais on sait qu'on a des enjeux de données qui continuent, on a des enjeux d'espace, on a des enjeux de main-d'œuvre. On fait un travail en recrutement qui ne cesse jamais, mais on a un focus sur votre santé et sur l'amélioration du système qui va vous donner le soin dont vous méritez dans votre communauté, dans le temps que vous l'avez besoin. Et nous continuerons d'être transparents à propos des deux, des enjeux qu'on fait face et du progrès qu'on fait. That's our commitment to you, is that we are focused on this work. We will communicate with you at every step of the way, from the announcement to the year later to the year after that, where things are going well, where they're not going as quickly as we'd like, because this is our number one priority. It is where we are putting our time and effort. It's what we want to make sure that you have the information that you need on, because this accountability matters, and making sure that accountability is experienced across the system. We have a complex health system of regional health authorities, of partners in the system, of different folks on the ground doing the work in clinics all over this province. We are moving to a new accountability model, a new electronic way of capturing that data and measuring it. And we are learning with our foot on the gas so that you get better health care as quickly as possible. Merci beaucoup.
Merci beaucoup, Madame Premier Ministre. Minister Dornan, thank you, Premier. Thank you, Minister Dornan. We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste a le droit à une question et un suivi très rapide. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Jacques Poitras, CBC.
Good morning. There's three top-line numbers I just want to check in on with you. There was 72.5% of New Brunswickers without a doctor from the State of the Province speech. There was the goal of 14,000 patients attached in the first group of clinics, and there was 125,000 registered on NB HealthLink that you were hoping to bring down. Do you have any news on any of those numbers?
So the first number that you described is a number that we only get to collect annually. As you are probably aware, it's done by phone survey by the New Brunswick Health Council, where they reach out and collect that data across the province. So unfortunately, that's a figure that we get on an annual basis. The second figure that you listed was the 14,000 patients attached to the clinics that we've announced. Yeah, so we're in different stages of that, as you would have heard me report on the 1,155 patients attached in Fredericton North, because we're coming up on their 1-year mark, so they're at about 72% of the goal. 277 patients attached in Tantramar, and right now a minus 73 in Lamec. Although the commitment in Lamec was a 3-year commitment. So different, and then we just announced a few clinics last week that are obviously rolling. I think at this point, the commitments with the clinics that we announced amount to about 17,000 patients attached as committed in those announcements. I think we're about a third of the way through that attachment, but as I articulated, the data challenges persist. The data that we were given about how many patients are currently rostered, we're realizing needs to be cleaned up because some of those are paper records of people who moved away or passed away or have changed their situation. And so we're working with data that is not as reliable as we'd like it to be as we focus on how many more patients we can get attached to each of these clinics. And Fredericton North's going to attach 1,600 more as they add on 2 new physicians in June. So it's I can appreciate what we're trying to get at here, right? Every time we announce a clinic, we set them a target for attachment. We're here to report on their progress towards those targets, and different clinics, depending on when we announce them, are a different way down the line of the attachment target that they were given. Now, then you referenced the 125,000 number on the HealthLink wait list, which we have always believed underestimates the amount of people needing care, because not everyone has put themselves on that list. And as the 72.5 figure shows, the Health Council survey gives us a very different number. And that also maybe demonstrates the frustration of this work. You've got people on a wait list documented. You've got a viable population survey that gives us another number. And what we're realizing, and I'm hoping can happen really quickly, is as we move each of these clinics to digital health records, then we can get a very clear picture of what New Brunswicker by their Medicare number is attached to what family physician or practice. And so now that we're past April 1 and the physician contract is in place, and each of these collaborative clinics are adopting that electronic medical record or getting the records all transitioned on, we are going to get better and better data as that percentage of paper records in doctors' offices get smaller and smaller and smaller. So at some point in the I don't know what kind of timeline to put on this. The sooner the better, but I imagine it's going to take us more than a year, and probably more than that, because we have some physicians in solo practice on paper-based records that aren't going to make the change until they're ready to transition their practice. But we want to get as many people in our system with reliable data as we can so that we can report that number, not in a way that's a 5,000 person survey and not in a way that's a voluntarily who signed up for a waiting list. And those are the two figures that we're working within right now, knowing that the truth is somewhere in the middle.
And just quickly on that point, you, in State of the Province speech, you extrapolated the figure of 238,000 from the 72.5%, and then the Health Council came out and said you can't really extrapolate that accurately from the percentage. What do you think of that number now? Like, do you agree that it may not be accurate, and how hard is it to really get a handle on this?
Yeah, it's extremely frustrating, right? We're using the best tools that we possibly can, and the Health Council does good work, and they do statistically valid surveys where they call people in all around the province. Now, we know phone surveys are one thing, but they follow appropriate methodology for that kind of polling. And if that's the top end, if 238 is the high end of who doesn't have attachment to primary care, then I want to work with that. I'd rather overestimate the amount of people we need to serve and get there quicker than underestimate, which we believe the HealthLink waitlist does, and not put in enough effort. That's why we're going after this every day. We put a physician contract in place, as Minister Dornan described, that is the best in the country, that focuses on attachment, and it rewards teams for attaching those patients. And now we're going through that accountability work of getting the team set up and then working with them to make sure that the behaviors change, that they are attaching patients and that they have adopted the digital record. And then that digital record can tell us very clearly how many New Brunswickers are attached to an active primary care provider. And so as we add on clinics, as they adopt these digital records, as other providers adopt the digital records under the contract, which means they have to share that data with us, we'll get a more and more accurate picture of the coverage. And so that's one of the reasons why we've invested so heavily in making sure that we have the information, the data we need to make the right policy decisions, to make the right investment decisions. We're using the best data that we have available today, and we're working on making that data better and better through the contract and through the steps that we're taking to get it clean.
Thank you. Anna Mandan, Global News.
Good morning. Of the number of patients attached to these collaborative care clinics, how many of them didn't have a primary care provider before this?
Oh, that's a great question, because when we talk about the 1,155 patients attached in Fredericton North, that doesn't include the 800 patients that were attached to one provider. That provider then left, but then they stayed with the clinic and they adopted them into the practice. The 1,155 in Fredericton North is new people who hadn't previously had a family doctor. But we are getting, as we get the information from the clinics who tell us how their staffing has changed over the last year, who's left, who's retired, who's come, which patients they've absorbed to new providers, but that we've prevented from finding themselves on the list. It's another one of the challenges of working to make this data clean. So we have been trying to get to that level of granularity. The numbers that I communicated today, the 277, those are people in the Tantramar region that didn't have attachment to primary care prior, because that's on top of the 2,000 patients that clinic is serving. And so they were serving patients that otherwise would have lost a provider, but they now have, I think it's 22, 25 at the Tantramar clinic. And so it's a mix, which is why it's hard to give a figure that says, okay, we've added this many unattached patients, but that's where the goals come in. So the goal of 17,000 unattached patients is a cumulative goal of each of the clinics that we've announced. We've made progress towards that. I think we're about a third of the way toward that 1 year in on the first clinics that we announced, and we'll continue to undertake the accountability exercise of checking in, making sure the work is happening, tweaking the supports, tweaking the designs, because the goal is patient attachment, which is why it's the number one figure that we're measuring ourselves on via the state of the province and that annual activity.
I understand the exact numbers are a little challenging, but at the same time, there are concerns about that. In February, we heard from Horizon CEO about hospital capacity concerns. So there are still serious concerns when it comes to healthcare access here in New Brunswick. How long do you see it taking before residents notice in their day-to-day life significant improvements there?
And the challenge is that some people are noticing a change today. If you're a patient that's now been attached to a clinic after you've been waiting for 3 years or 5 years, then you're seeing that benefit directly. And so if you talk to 277 folks in Tantramar, they'll tell you they're seeing it right now. If you talk to somebody that's still waiting because they haven't been attached, they'll tell you they're not seeing any change. It's very personal, similar to the families that have just been moved out of hospital and into spaces in the new nursing home in Armagh. They'll tell you they've seen a big change, and then you have the rest of the patients that haven't yet moved out into care that haven't seen changes at all, which is why we have to do these activities at looking at what's under the surface. Are we increasing the population of healthcare providers to provide that care? Yes, and we're doing so faster than New Brunswick has ever done so before. Are we creating the beds that we need to take that pressure off of? So then we use that nursing home waitlist figure, and that nursing home waitlist figure is at 1,038 right now, 50 fewer than the target that we had set of 1,088, because we see the demographic pressure that is trying to push that number up. But we've changed our processes for assessment, our processes to move people into appropriate environments of care, supports to special care homes, supports to at-home care to reduce the pressure. So that one's going in the right direction, but it's still going to take quite a bit of time to create 1,038 more spaces in long-term care, while that number likely grows because we haven't reached the top of the baby boom yet. So, it's the numbers are always moving, but I feel very confident that we've got the right contracts in place with our healthcare professionals, with our nurses, with our doctors, with personal support workers, with the unions. We have come through a round of negotiation of labor agreements across the health system that have gone very well. And so we have better rates of retention now, a more stable system. And I want New Brunswickers to feel the benefit of that as soon as possible. But the work has been put in on the contracts and on the pay, on the model, on the policy changes that we need to, and the investments into long-term care. Now we've got to get the shovels in the ground. We've got to get the clinics open. We've got to get the patients attached so that people do actually feel the results. We see that 72.5 going in the other direction. And certainly we are aiming for that to happen as we committed to before our time is done. We're 18 months in, we've got 2.5 years left, and we are working as hard as we can to make sure New Brunswickers feel the results of the effort being made as quickly as possible.
Natalie's
has already reported that the number of what we call CTAS 4s and 5s, these are people that are not requiring emergency care, could be cared by a family medicine. The percentage of those people that go to the Vitality ERs is significantly reduced. And so they are monitoring that. We are monitoring that. There are still people that are going there that aren't yet attached. But the more that get attached, the fewer that will have to come into the emergency department. And that's very important. We want our emergency departments to be looking after emergencies, not patients that should be seen by primary care.
Thank you. Natalie Sturgeon, CHCO St. Croix Courier.
Thank you for taking my questions. I know we talked about 3 clinics, but I'm going to ask about St. Stephen because we know that the physical space is one of the limitations that it is experiencing challenges with, and the property on King Street is under renovation. I'm just wondering if you have an update on St. Stephen, specifically where that physical property stands and where the clinic is in terms of doctors and patient onboarding.
I can provide some update for you, Natalie. The renovations are progressing, and so we're pushing for them to move more quickly than they currently are, but that hasn't stopped the work. So the good news is that we have added capacity to the team in St. Stephen. They've attached 572 more patients to date. And so we are seeing more people in the St. Stephen region get attached to primary care. We had an aggressive target set for them of 3,000 patients to be attached in a time frame that included moving into the new space and taking time to get up to speed. So They've added almost 600 patients in the last number of months since that announcement was November 25th of 2025. So they've done some good work to add in 600 people, even though they're very constrained by the space in the Charlotte County Hospital, and we're pushing to move those renovations more quickly.
So the 600 patients, were they in addition to the 310 patients that were already onboarded in February when it opened in the Charlotte County Hospital?
That's a good question. The information I have here provided a baseline of 732 patients at the time of announcement and an addition of 572 since then. So a total attachment of 1,304 patients at that clinic. Whether that includes the 300 that you mentioned or not, I would assume the 1,304 does include those folks. But the timing, you said February?
Yes.
Yeah, I'd have to check whether that 572 is inclusive of the 300, because it doesn't sound to me like they were counted in the baseline figure that I was given.
Okay, thank you.
Andrew Waugh, Post Media.
Hey, spoke a lot about the clinics this morning, but one thing you didn't talk about is what's the timelines for these patients getting access to these clinics? Have you hit the 5 days? Can you walk me through each clinic and tell me what the access is?
That's a great question. Thank you for that. Because that is something we measure by, the way they measure it is third next available appointment and how many days to get that appointment. That metric had been moving in the right direction. So we reported at the State of the Province that we saw an improvement in time to access care, a significant improvement. I think it went from 31 to 34%. So a 3% increase, or 10% of the total increase on people who had primary care and could then get in more quickly than they could in the past. That figure we have on an aggregate level annually. Clinic by clinic, we didn't have baseline data for a lot of clinics, so to be able to tell what was it and what is it now we don't have that previous measure. Now that we're moving them on to digital health records, that allows us to capture that data on third next available appointment and determine how many days it is in that clinic, and then help them work to get toward the goal of 5 days or less. Not every clinic, depending on where they were in the announcement schedule, right? There's the ones back that we announced back in April, they've adopted EMRs. They've started pulling that data to report. I don't have the time to wait per clinic, but let me see if we can get that for you. As I mentioned, we have some data challenges. We can? Okay, glad to hear it and get that reported on a clinic by clinic basis. Maybe we can add that into a future update.
Quantity and quality, right? We talk about the number of people that are attached, but if you're attached and can't be seen for 3 weeks, are you really attached? And so we hold our clinics to those numbers. If you can be seen within 5 days, most of the problems that you present with are treatable. And so when we talk to the clinics, we want to make sure that there's quantity and also quality. And so they meet that by the 5-day mark.
That's a good point. It's worth explaining maybe to New Brunswickers as well as everyone here that when we say, 2 new physicians are going to take on 1,600 new patients, that doesn't mean day one on the job they roster 1,600 people, because then all 1,600 people would be waiting a very long time to get that first appointment. They tend to work in between 50 to 80 patients a month that they can onboard. Onboarding appointments, as you can imagine, are longer appointments than a typical appointment. You've got to get a medical history, you've got to get familiar with each other and capture extra information. And so most physicians will intersperse new patients with existing patients just because it's a slightly different kind of work. And so we see that. We see that they can add, 50 to 100 a month and work through that. So if we have 2 physicians at 1,600, that's 800 each. It's going to take them about a year and a bit to get everybody onboarded. And then those wait times sort of kick in. Does that make sense? There's a process to doing this that takes time, as we've been learning, as we've been setting attachment targets and completion timelines for these clinics to be set up and fully rolling.
Another thing that wasn't discussed here today, but France de Rosier was discussing it yesterday, which is the base budget review of the regional health authorities. We know they're funded on a 2008 model based on 85% capacity. We know that hasn't been the case for a very long time. She said she has no hope that the base budget review will lead to more money for Vitality, and that they've already moved on trying to find other efficiencies like AI. So I wanted to get reaction from both of you on that, please.
I'll take that. we are under a framework of constraint, but that doesn't mean we don't do what's necessary. And Dr. Desrosiers and Margaret Melanson are very good at making do with the dollars that they have, and they've made that clear to us. So I'm not sure I would say no hope. A base budget review is asking a question where we don't know the answer. We didn't do it because we knew the answer. And so we continue to work on that. We will fund appropriately. And that's part of a base budget review. And if it means that in some instances we have to sharpen our pencil, do more. And I know that Dr. Desrosiers and Margaret Melanson are coming up with new proposals. They're speaking to us in government about priorities, about new initiatives that can help them deliver better care at a reduced cost. And we've asked them to do that. They've delivered on that. I wouldn't go so far as to say there's no hope. Regardless of the environment, regardless of the budget, they're doing neat new things. I mean, the collaborative care clinics that are springing up in Vitalité is something new. It's serving patients, keeping them out of their ER. So I would not say I have no hope. I have a lot of hope in what they've been doing.
Well, and I would take it the other way. You referenced that Dr. Desrosiers suggested that they're going to adopt AI. That's a good thing. We should be leveraging technology in the system wherever we can. We have a shortage of healthcare professionals, and we want to put them to the best use at the patient's bedside, not spending all their time charting or doing administrative work. So if we can adopt the kind of tools that means our healthcare professionals are actually caring for patients, then we can deliver better outcomes to patients at less cost and probably faster. So I'm really pleased to hear that Dr. Desrosiers is exploring AI. We've already seen it. Actually, I think she or Patrick was at the announcement in Lamec about the deployment of Vitre to the clinic up there. It's something we're going to have to do more and more across the system. That was part of the base budget review, was looking at the cost to deliver health services that are experienced in other provinces. Where are we paying more? Where do we maybe have inefficiencies and waste? What could we deliver differently? Because we're not in a 2008 healthcare model right now. We don't have the same population we had in 2008. It is more diverse. It is older. Its needs are different. We should not be propping up a status quo healthcare system that isn't serving us. We should be changing that delivery model, deploying technology, putting our healthcare professionals to their best use in a system that is collaborative and integrated. So I'm pleased to hear that Dr. Desrosiers is looking even more at the adoption of technology to help us deliver the most cost-effective and best care possible.
Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour. Je l'ai peut-être manqué, mais je pense pas que vous avez répondu à la question du genre sur le nombre de personnes qui sont en attente d'avoir un fournisseur de soins primaires. C'était 125 000 personnes en octobre sur la liste de liens santé NB. J'aimerais savoir où est-ce que vous en êtes là-dessus.
Je peux checker c'est quoi le chiffre du lien santé aujourd'hui. Je pense que c'est un chiffre public, mais peut-être un de nos collègues peut me donner le chiffre du moment. Mais je vais répéter qu'on pense que ce chiffre-là est trop bas, que ce n'est pas une réflexion de la population au complet qui attend ou qui ont besoin de services de soins primaires. Même que le chiffre qu'on utilise, qui est venu du Conseil de santé, est probablement trop haut. Alors, ça nous donne des paramètres de savoir c'est qui s'est mis sur la liste d'attente, c'est quand on fait un sondage de la population qui nous partage, qui n'ont pas de médecin de famille. Et maintenant, on fait le travail vraiment important d'avoir des données claires et fiable de quel chiffre de Medicare est attaché à quel professionnel de santé à chaque fois qu'on a des instances de l'adoption de systèmes de santé électroniques. Alors, si vous nous donnez quelques moments, je pense qu'on peut vous donner le chiffre du moment de liens santé et leur liste d'attente. Et je vais peut-être répondre à une autre question et revenir quand les chiffres sont partagés.
As-tu suivi, M. Boudreau?
D'accord, merci. Il y a beaucoup de mes questions qui ont déjà été répondues, en fait. Donc, je vais poser une question sur un autre sujet. Je voulais savoir, Mme Holt, est-ce que vous avez songé à légiférer pour interdire l'utilisation des médias sociaux et des chatbots d'intelligence artificielle aux jeunes, comme le Manitoba a annoncé l'intention de le faire? Puis, sinon, est-ce que vous pensez que le gouvernement fédéral devrait le faire?
Mais ça, c'est une conversation particulièrement au sujet des écoles, le rôle des écrans, des cellulaires dans les écoles. C'est quelque chose qu'on parle depuis longtemps. Moi, comme mère de 3 filles, une de 14 ans, qui aimerait avoir un téléphone, mais elle n'a pas. Elle est certaine qu'elle est la seule fille dans son école qui n'a pas un téléphone cellulaire, mais tant pis. Et elle n'a pas accès aux comptes de médias sociaux non plus et pas ses sœurs non plus. Moi, je pense que ceci, c'est un enjeu vraiment sérieux. Et on regarde avec un gros intérêt ce qu'ils ont fait en Australie parce qu'ils ont mis cette politique que les jeunes moins de 16 ans n'ont pas accès. On regarde qu'est-ce qu'ils ont fait en Manitoba, puis la conversation avec le gouvernement fédéral. Clairement, ceci, c'est quelque chose qui est un enjeu et un risque. Et on doit améliorer la façon dont on protège nos jeunes. Alors, pour moi, je pense que c'est un avancement intéressant et on a des recherches à faire pour trouver comment le Nouveau-Brunswick peut protéger nos jeunes en école puis dans notre système de façon meilleure, mais avec aussi une opportunité. Je pense que je l'ai dit. C'est toujours difficile comme parents et comme société de déterminer combien on protège et combien on laisse apprendre eux-mêmes. Alors, il y a beaucoup de recherches, beaucoup de psychologues qui ont des perspectives qui seront vraiment au courant parce que le système des médias sociaux change à chaque jour et on essaie de créer des politiques et des environnements qui limitent les risques le plus que possible.
Frédéric Camarano, Radio-Canada.
Bonjour. Je veux revenir un instant sur, si vous voulez, la définition des cliniques de soins collaboratifs. Vous nous avez parlé de cliniques que vous n'allez jamais annoncer. Je pense que c'est des professionnels qui travaillent un peu ensemble, mais de manière plus informelle. C'est quoi la différence entre les cliniques qui sont annoncées, celles qui ne le sont pas, et est-ce que celles qui ne le sont pas reçoivent une aide du gouvernement?
Oui, alors la différence, c'est peut-être que c'est ça, qui ne sont pas annoncés, mais ça ne veut pas dire qu'ils ne sont pas des cliniques de soins collaboratifs. Dans le contrat qu'on a signé avec la Société médicale, il y avait 3 options. Puis ça, c'était nouveau d'avoir des options et des choix comme un professionnel de soins primaires. Ça, c'est une des choses les plus attirantes de notre contrat. Alors, ils pouvaient rester comme tel. Un médecin de famille solo, sans collaboration. Alors, il y avait des conditions et des rémunérations qui vont avec ce choix. Ou ils peuvent choisir d'être en pratique dans un groupe et ils vont recevoir des supports pour leur système d'information digital et de support pour leur équipe. Ou ils peuvent choisir le Deluxe, l'équipe collaborative qui leur donne du support pour les infirmières, pour l'administration. Les 2 modèles en groupe et collaboratif ont un frais de capitation. Je ne sais pas c'est quoi en français.
Oui, c'est 3 niveaux de capitation, oui. Le premier est pour le médecin qui practice solo. Oui, le meilleur est le groupe, l'équipe de physiciens qui a un système électronique, mais ils ne pratiquent ensemble. Mais le troisième, le meilleur clinique est les physiciens et les nurses praticiens et autres qui travaillent ensemble. Si un médecin est malade, l'autre look after the patients. Et if a medicine retires, those patients are still cared for.
Alors, on annonce des cliniques collaboratives, complètement collaboratives, le niveau 3, si je peux dire ça. Vitalité, ils créent des cliniques collaboratives aussi avec des médecins du jour et on n'annonce pas chacun de ces formations, mais ils ne sont pas différents. Peut-être ils ont choisi le modèle de groupe, peut-être ils ont choisi le modèle au complet collaboratif. Nous autres, on a choisi des endroits où on savait qu'il y avait un besoin et on voulait voir un accès à des cliniques collaboratives partout dans la province. Il y en a où ça bouge d'une façon organique. Puis ça, on célèbre parce qu'au fin du jour, ce qu'on veut voir, c'est que chaque néo-brunswickois a accès à un soin collaboratif proche de chez soi par la bonne équipe. Alors, on veut que tout le monde adopte ce modèle et ça, c'est pourquoi on a un contrat incroyable qui leur donne des incitatifs à ce modèle-là.
Et je revenais un instant sur la fécondation in vitro sur laquelle vous avez touché. Vous parlez d'une population qu'il va falloir grandir pour assurer les besoins d'emploi, etc. Est-ce que vous êtes donc en train de dire à quelque part d'encourager les Néo-Brunswickois à avoir plus d'enfants? Puis si c'est votre position, est-ce que vous comptez ajouter d'autres mesures, améliorer les services de garderie, par exemple?
Bien, ça, c'est une excellente question parce que clairement, on a besoin d'une population qui agrandit pour supporter les besoins de notre économie. On a besoin de la main-d'œuvre dans le système de santé et plusieurs autres secteurs de notre économie. Alors, on ne peut pas tous immigrer ce talent et vont avoir un point dans le futur où la compétition pour les immigrants ça va être beaucoup plus compétitif que c'est aujourd'hui. Nous sommes vraiment chanceux ici à Nouveau-Brunswick et au Canada d'être un environnement où beaucoup de monde veut déménager. Ils veulent venir à Nouveau-Brunswick nous joindre et ajouter à notre population pour servir dans nos foyers de soins, dans notre système médical, dans la construction de logements abordables. Vous avez suggéré la question de garderies abordables. Bien, ça, c'est quelque chose qu'on travaille là-dessus depuis longtemps, d'un financement pour rendre les places en garderie moins chères qu'ils étaient. Alors, on a vu que ce prix a diminué autour du temps. Vous avez vu notre programme de petit déjeuner gratuit en école, des choses qui fait qu'avoir des enfants et une famille, c'est moins cher que c'était. Et on va avoir un programme de déjeuner scolaire qui s'en vient aussi pour aider à la coût de la vie des familles. Ce programme ici, c'est quelque chose qui ajoute à ça. Ça ne devrait pas être vos moyens qui déterminent si vous pouvez avoir accès à une famille et les processus de FIV et de IIU. Et je trouve que c'est incroyable qu'on a plus que doublé le montant de familles qui peuvent maintenant avoir cet accès. C'est 368 familles. J'entends des messages de eux autres. C'est quelque chose de vraiment spécial. Et on travaille à chaque jour d'essayer de rendre le Nouveau-Brunswick une place plus abordable. Les factures d'électricité, les taux de loyer avec notre plafond de loyer, le gel qu'on a fait sur les impôts fonciers pour les maisons de famille. On cherche à trouver des façons que vous pouvez s'installer à Nouveau-Brunswick et vivre d'une façon confortable et prospère avec une vie abordable.
Nick Moore, CTV.
Thank you. Well, why do there continue to be doctor recruitment challenges in Campbellton, St. John, and Fredericton? Are these the same issues? Are there new issues? And what's being done to address that there?
So the survey did give us some insight into where we had a deficit of family doctors. And Fredericton was the number one area. We looked at Miramichi, for example. And, we apply incentives to doctors to go to underserved areas, and that does help somewhat. But at the end of the day, physicians make a choice. One of the things that I'm quite encouraged about is that the local towns step up. In Hampton, for example, they help with the build of a new collaborative care center clinic. And we look at ways that are not directly related to the salaries of physicians, but rather lifestyle, welcoming them to the community. And I would dare say there's not very many communities that haven't stepped up to help us recruit physicians. At the end of the day, it's still a physician's choice. We cannot force people to go there. The only time we've had an opportunity to do that is with our practice-ready assessment physicians. We have put them preferentially to areas in need, like Campbellton. We put 2 PRA physicians up there last year, and continue to bias where we ask those people to go for a return of service. But right now, we are not doing a lot of return of services. We are biasing our recruitment efforts towards those towns. And as you may have heard, getting a surgeon, family doctors in the Woodstock area has been successful because we put additional resources to that. So it's always a challenge. There'll always be areas, and since I've been practicing in New Brunswick, some areas that don't have enough people, but our towns are stepping up. We're recognizing what it takes, and so we are optimistic.
And yeah, I'd like to ask about comments made a few weeks ago by the Health Minister in Prince Edward Island about a maritime nursing unit. What can you say from New Brunswick's side? And also, are there any other discussions or meetings happening about collaboration regionally when it comes to healthcare?
Yes, we are looking at that. It's a novel idea, perhaps a good one. We are not committed to going that route at this point in time, but I can commit that we are looking at that. No news today.
Any other regional collaboration meetings happening?
Well, as you know, our efforts at reducing provincial barriers vis-a-vis nurses and physicians is working. People are getting their paperwork done in a Canadian province, and they're coming here more quickly. Physicians, for example, that have gotten their credentials in Alberta and other provinces, when they come here, we still look at them. We retain that ability, but the process is much shorter for nurses and physicians that have gotten certification elsewhere. So that is helping our recruitment efforts.
Eli, Canadian Press.
Just to the Premier, I know you met with the Prime Minister last week and you had mentioned that healthcare was a topic and that's what we're talking about here. Is there anything during that meeting that maybe came up that would contribute to some of the efforts that you're talking about today over the next year or a couple of years?
The conversation with the Prime Minister and with the Minister of Health were focused on health infrastructure and the fact that the federal government had made available some matching funds to invest in health infrastructure. So a little bit different than the conversation today, but they're obviously integrated. We need spaces that are optimized for patients and for healthcare professionals because, as the minister said, when they can choose to practice anywhere in this country, they want to practice in environments that are well equipped and modern and are comfortable places to work. And so making sure that we are refreshing and keeping in top grade our health infrastructure, particularly our acute care facilities, but as well our collaborative care facilities. That was the conversation with the Prime Minister, and the Minister was aligning our priorities on health infrastructure investments that we can do together.
Dernière question, last question, Wilfred, Acadia Broadcasting.
Thank you. So I just wanted to ask about the space issues and facility limitations you'd mentioned with Tantramar. Richard LeMay, Director of Primary Healthcare for that region, said they estimated close to 1,400 could be onboarded within the next year, but attached has only reached 277, if I recall correctly. Is the next step for that clinic addressing those space issues and potentially an outdated and marking it as potentially an outdated facility, or is there another avenue you plan to travel down?
Well, the current space that they have there it's not a bad space, and they have professionals working out of that space now. And as I mentioned, those folks, now that they've gone through a bit of a cleanup on their patient list, are going to be attaching more patients even within that current space. But the project to expand, to design new, longer-term space that is going to work for, and the goal is about 1,000. That was the amount of patients remaining on the wait list at that time. It's possible that it's grown to 1,400 because Richard LeMay is good. He's got good data, as good as it can get in this system. So that's expected to be about an 18-month project to design the new clinical space in partnership with the Rural Health Action Group. So we're attaching more patients to the team as is, and we're working on the challenge of space to make sure that we can attach everyone in the community with the right kind of space in the near term.
Thank you. Premier?
Can I just check that we got the HealthLink figure?
Getting it. As soon as we get it, we'll make sure everyone in this room and Alexander gets it.
Okay.
Ça marche? So,
Excellent.
Premier?
Well, I don't mind repeating myself. Le système de santé, c'est notre priorité numéro 1 et on pense que le Néo-Brunswickois mérite une comptabilité, une imputabilité. Lequel est le meilleur mot? Jacques, tu ne sais pas? Frédéric? Comptabilité, imputabilité? OK, merci. On pense que les Néo-Brunswickois méritent une imputabilité sur notre travail, sur leur priorité numéro 1. Et c'est pas le fait de juste faire des annonces, puis partir, et on ne sait jamais si cette annonce a venu à quelque chose. Nous autres, on veut retourner au travail et aux promesses d'une année passée, aux cliniques. Les premiers 3 qu'on a fait en avril de 2025. Aujourd'hui, c'est 14 cliniques qu'on a ouvertes. Demain, la semaine prochaine, ça va être 15. Le progrès est là pour commencer ces initiatives. Notre gouvernement veut continuer d'assurer que notre travail nous donne des résultats. et qu'on peut voir et sentir ces résultats dans la population. Alors, on voit un progrès avec la rétention de nos professionnels de santé, particulièrement nos infirmières, où on a vu un beau progrès, une diminution de le taux de roule jusqu'à presque moins que 1%. On a vu de beaux progrès sur notre plan de santé. Ce n'est pas un document qui reste à l'étagère. C'est un plan que déjà, on a 26% du plan accompli et le travail continue. Et on va continuer de partager avec vous les enjeux, les délais, là où ça ne va pas bien, et aussi là où on voit le progrès réel dans le système de notre travail à chaque jour. For us, healthcare is our number one priority, and we believe that New Brunswickers deserve to have accountability and transparency on what's happening in the healthcare system. It's not enough to make an announcement about good news to kick off a clinic. You've got to come back a year later and tell people how you're doing and how it's going and where it's going well and where maybe it isn't going well. And so we've seen good progress in the opening of clinics, 14 to date with our 15th next week. That means we'll be half the way towards our goal of 30 clinics at just about the 18-month mark in our mandate. But we see that we've learned from these clinic rollouts, that we have data to clean up, that we have space issues to address, that we have a high degree of turnover in our healthcare system because of a population that has doctors and nurses ready for retirement, which is why we put recruitment and retention into full gear, and we saw our retention investments for nurses pay off with an improvement in turnover from what was 5.54% down to less than 1% of nurses in the Horizon system. That gives us stability that allows us to better serve patients. And then we added more doctors in New Brunswick this year than any other year, and 15 of those being family doctors, net new family doctors, 55 new family doctors recruited, and 40 lost to retirement or moves. So the work is continuing. We will share with you the progress. The provincial health plan is not just a plan sitting on a shelf. It's a document that the team actively got to work on and have already accomplished a quarter of the commitments in that plan. We are going to share with you at every step of the way how things are going, how we're measuring it, how we're building accountability and transparency into the system going forward with the investments that we've made into people and into technology so that you get better care close to home as quickly as possible. Thank you.
Merci. Thank you. That concludes today's update. Ça termine notre mise à jour. Merci beaucoup.